So with everything going on in the current pandemic as well as the coronavirus, people losing their jobs, other people getting laid off, people losing contracts, schools being canceled, people just can't work. Well, there has been 5 things that I have learned and took away from this, things that I have observed, and I just wanted to share those things with you guys. What's up everyone, this is Dr. Webb here. Thank you guys for watching this video. Make sure you subscribe. New videos coming every week, you don't want to miss them. So, people losing their jobs, other people can't go to work or working from home, taking reduced salaries, everything going on in this world where, you're seeing people wearing masks around, other people are dying, people getting sick, hospitals are overfilled. I've observed a couple different things and things that I have taken away from this last few weeks with this pandemic. With any point in my life when there is some type of hardship or some type of failure, some type of challenging, event, I always analyze, take a step back and say, what can I take away from this particular aspect of my life to better myself in the future? Well, I've come up with 5 things for you guys, things that I have learned, and hopefully someone can benefit from this video. The first thing that I have observed as well as, learned from this whole pandemic is that you have to live within your means. There's a saying out there that one should live like a resident, so later you don't have to live like a resident. One should, stay within your means. You don't have to keep up with the Joneses. The problem is, and where people get into trouble or they fall into trouble, is when they do not live within their means. So you're going through this whole medical training, college, medical school, residency, fellowship, and then you get out of fellowship, and then the first thing you do is go buy a $2 million house or a $800,000 house or go buy a $90,000 car. Well, that's probably not the best thing to do, and I can't speak about everyone's situation, but most people would recommend, the people that are the financial kind of gurus, you read the books like White Coat Investor or Rich Dad Poor Dad or Dave Ramsey's Financial Peace University, these are the people that would recommend that you live within your means so that if something like this does happen and if you're getting laid off or you're losing hours at work, it doesn't faze you. So I will put some resources in the description below about living within your means. This means that, if you have a salary, and I have videos about how much residents make during their residency training, I'll put that right up here. But that salary, say for instance, it's $65,000. When you become a fellow, that salary is not going to increase that much. And then when you become an attending, you should, live within, that $65,000, $85,000 range. Even though your salary may go up by 10, by 15, some people may go up by 20, you need to live within your means because you just don't know what may happen. You may get to your job or to your first, assignment as an attending and you get laid off or they fire you for some crazy reason, and then you have this $800,000 house that you have to pay for each month. So live within your means, live like a resident for the first, let's say, 5 years out of your training so that later you don't have to live like a resident. You don't have all these bills and things that, is consuming all of your income, and you don't have to work crazy hours to, pay all of your bills. So live within your means. That's one thing that I have, picked up from this whole pandemic is that we have to live within our means. And the second tip that I have for you guys, it goes along with number 1, is actually to have an emergency fund. When me and my wife took, the Dave Ramsey Financial Peace University course a couple years ago, that is one of the first steps that he recommends for people to get out of debt and to become financially independent. Well, he has 7 baby steps and we are following those baby steps now. But the first thing that he recommends is that you have an emergency fund. Life happens. You may have a tire that's blown out or someone may break your window out of your car and you have to pay the deductible for that. Someone gets sick in your family or, some charge that comes up that you have to pay before it goes to the debt collectors. Well, life happens and things happen, and you must prepare for those things. So that's the reason why Dave Ramsey recommends this as the number one thing before you pay off your debt, before you start applying money to other situations and other parts of your life. You have to have an emergency fund. And this emergency fund that he recommends is usually 3 to 6 months of your monthly salary. Let's say you make $20,000 per month. Well, in the bank, you should have between $60,000 to $120,000 in the bank in case you lose your job, you get sick. If you have a laceration on your hand and you're a surgeon, well, you can't operate and you don't have disability insurance. Well, this emergency fund allows for you to be less stressful during this time. A lot of doctors who are in private practice where they have to pay overhead each month. And if you don't know what overhead is, this is an amount of money where you have to pay each month for your employees, for the paper, for the printers, for the office space, for utilities of your office, any of the business operating expenses. And this can be very expensive for, a lot of people. Some surgeons, different practices that I have met with along this interview process are paying $40,000 a month or $50,000 a month for overhead. And I've heard of situations where this overhead is even higher than that. So as a surgeon, if your overhead, let's say it's $40,000 per month, well, you don't make any money or you don't take home any money unless you bring home more than $40,000 in your surgeries and your clinics, consultations, ER visits, all those things kind of add up. And if you generate, let's say $100,000, well, $40,000 of that is going to overhead. $60,000 is going towards you, but you still have to pay taxes on the whole $100,000. So that's why it's really important to have an emergency fund. So the doctors now that have these businesses or different practices, and they can't work or can't operate or see patients because of the coronavirus, well, you still have to pay overhead. So a lot of doctors are taking out loans, they're dipping into their savings, or a lot of people may lose their practice or their business because of this. So 3 to 6 months of an emergency fund. If you're a physician, I would recommend that you do this as well for your business. You can have a personal one for your personal account, 3 to 6 months of emergency fund. For your business, 3 to 6 months of emergency fund. That's what I have taken away from this whole ordeal. That's extremely important. So you're not scrambling to see how you're going to pay your rent, how you're going to pay your employees, how are you going to make that car note. If you would have lived within your means and had this emergency fund set up, life would be probably less stressful for a lot of people out there. The third thing that I have observed and I have taken away from this whole ordeal is that you have to have multiple sources of income. So as a doctor, you may have your money that you're receiving from, doing surgeries or seeing patients or working in the ER. But if something happens where you can't work because of the coronavirus, or if you get sick, death in the family, you have to travel, your kid gets sick and you have to take them somewhere for cancer treatment, life happens. And if that one source of income is your only source of income, well, if you can't work, you don't have any money coming in, and you still have to pay those bills, you still have to pay overhead, so it can become, really stressful. What I've taken away from this is that multiple sources of income is essential, whether this is consulting, writing a book, speaking, investments, stock market, multiple sources of income, so that one income decreases dramatically or you don't have it for 4 months, that you have these other sources of income that can supplement that. That's another thing that I've taken away. The fourth thing that I have taken away from this whole ordeal is that as a physician, it's a lifelong learning process. So when you go through college, you go through medical school, go through residency, you go through fellowship, each portion of this training process is added upon what you've learned before in the previous aspect of that training. So what you learned in medical school will reflect what you learn in residency, and what you learn in fellowship, you have to take it what you learned in as a resident. So, each portion of this training adds on to the previous, and as a physician, 20, 30 years from now, you're still going to be learning. I always tell the story of this plastic surgeon that I worked with in San Antonio, and in my last year of training there, I was a fifth-year resident. This surgeon had to be out of training, let's say 30 plus years. And before one of our surgeries, I saw him kind of early in the morning in the operating room looking at his anatomy book. He was going through the anatomy. So, that just told me that, 20 years from now, there may be questions that I still have, things that I'm not really sure about, that, I still have to read, I still have to look at the literature, look at the research, to, better myself, make myself a better doctor. So, medicine, lifelong learning process. This whole coronavirus pandemic, no one's going to sit there and spoon feed you information. You have to go to the articles, look up different research, projects, different things out there to educate yourself. Medical school, they're going to spoon feed you information. As a resident, not really, not so much. You do still have lectures, but it's not like in medical school where you're having lectures every day. You are responsible for making sure that you have a plan throughout the entire year so that you are learning the information well so that you can become a competent doctor. And the way that they make sure that you're learning the information is that every year on November 11th, every orthopedic surgery resident takes a 8-hour exam, and this 8-hour exam can cover anything in orthopedics. So throughout the year, you have to study for this exam. That means even though you may be working 80 hours a week, you still have to find time to come home and study. That's why people who are self-driven and who are motivated do really well in medical school and in residency, because no one has to tell that person, hey, go study this, or go home and read this chapter. So you have to look at medicine as a lifelong learning process, review different concepts that you don't understand. Make sure you're staying up to date on the latest research and the latest developments in your particular field, because once we have times like this where, the information that you may need to know may help save a patient's life, i.e. coronavirus, it's ultimately up to you as a physician to make sure that you know that information. And the last thing that I have learned from this whole ordeal and what I have taken away is that the information, the knowledge, and the skill sets that you learn in your medical training in medical school, physical exam skills, how to listen to the heart and lungs, how to work a mechanical ventilator, or how to read a ABG or arterial blood gas. These are the things that the skill sets, the knowledge, these are the things that you will have to know. So when it comes down to needing this knowledge, you will be able to retrieve that knowledge and be able to apply it to whatever situation or scenario that you're in. There are a lot of doctors now that are being pulled to the front lines to work in the ICU or work in the ER, and they're not internal medicine doctors, or they're not ER doctors. They're other specialties who may have not seen this information for 20 years, 15 years, or not have seen a mechanical ventilator, what ventilator settings the patient may need when they come into the the ICU. So all of these skill sets that you learn, you're going to have to constantly refresh yourself, constantly teach yourself, go over these skill sets. So when it comes down to you being put on the front lines, you're ready. So these are the things that I have learned and taken away from this whole scenario. You have to live within your means. Have an emergency fund of 3 to 6 months, personal one as well as one for your business. You have to have multiple sources of income. You have to understand that medicine is a lifelong learning process, and you have to know that the skill sets as well as the knowledge that you learn in your medical training, that this information may be needed at a later time, 20 years from now, 30 years from now. If we have another pandemic in the future or some type of wartime environment, well, those skills that I learned in medical school, I'm going to have to be able to utilize those skills, that knowledge in those situations, and you have to be ready. So these are the 5 things that I've learned. I hope you guys learned something in this video. Put it in the comments below. What have you learned from this whole ordeal? What are you going to take away from everything that's going on? What are you going to take away to better yourself in the future? let me know. I would love to hear from you. Thank you guys for watching this video. Make sure you subscribe. New videos coming every week. We'll see you next time.